Welcome to Pressure Injury and Prevention, Risks, Barriers, and Your Role in Prevention, a Frontline Forces training presented by Superior Health Quality Alliance. This learning module was developed with the nursing assistant in mind and created specifically for those working in nursing homes and long-term care. This course will provide an overview of pressure injuries and will build on your current knowledge. You, the nursing assistant, play a critical role in noticing small and subtle skin changes on residents in your care. Why? Because nursing assistants have multiple opportunities to observe resident skin throughout the day, such as when assisting a resident to bathe, dress, or toilet, or when using devices or medical equipment such as braces and oxygen tubing. Superior Health aims to empower nursing assistants by increasing your confidence with making the right decisions and knowing when to tell someone what you see, as well as improving the ability to identify risks to prevent pressure injuries. The purpose of this course is to further your learning and application of these skills to real-life situations and identify what you can do to improve quality and safety of resident care. This learning module, Pressure Injury and Prevention, is comprised of a three-part series. You are viewing the third installment in the series entitled Risks, Barriers, and Your Role in Pressure Injury Prevention, which explores valuable interventions for pressure injury prevention. The first of the series, Causes and Risk Factors, provides an overview of the cost, impact, causes, and risk factors leading to the development of pressure injuries. Section 2, Stages of a Pressure Injury, provides a visual and clinical overview of pressure injury staging. It is not necessary to complete the entire series in one sitting. You can exit and return to the course at any time. After completing this section, there will be a link to a survey to test your knowledge. Let's review our learning objectives. After completing this training, nursing assistants will be able to describe the nursing assistant role in the prevention of pressure injuries, recognize what places a resident more at risk for developing a pressure injury, discuss examples of interventions found on an individualized care plan, explain added actions you can take in your daily routine to prevent pressure injuries. Identify activities to avoid when caring for a resident at risk of developing a pressure injury. List prevention interventions, tools, and devices. Detect barriers to pressure injury prevention. And finally, nursing assistants will know when and what to communicate to the nurse. The development of a pressure injury is a significant health and patient safety issue. Helping residents to keep their skin healthy and free from pressure or other injuries is an area where you, the nursing assistant, can make an important difference every day. As mentioned in Section 1, pressure injuries are financially, physically, and emotionally costly. They are expensive to treat, can be painful, can affect the resident's mobility, and can result in other serious problems such as infections. These problems can lead to a resident needing lengthy treatments, increased medication use and hospitalizations, and can even lead to death. The nursing assistant plays a vital role as the person who can recognize and report changes in skin appearance in a timely manner. Nursing assistants are also vital in providing timely and evidence-based preventative care. Communicating changes in skin condition early is crucial to avoiding or preventing further injury and harm to the resident. As the nursing assistant, many times you have the first contact with the resident. You often see the resident and their skin first thing in the morning and in the evening as you help with cares. You give bed baths, assist with perineal care, turn and reposition residents, and aid with their feeding. You are key in providing care and support to residents and in sharing what you see with nurses. As you look for and notice changes in the resident's skin, the nurse and resident are grateful to you as you share updates on the changes you detect. As mentioned in Section 2, residents can be at a higher risk of developing a pressure injury for a variety of reasons. Before we discuss prevention in more detail, let's review the risks residents commonly have for developing a pressure injury. The aging process itself can cause older persons to have fragile, thin skin that can be easily injured. Aging residents are also at increased risk if they have decreased mobility or an inability to move or shift positions on their own. Exposure to moisture on the skin caused by incontinence of urine or stool, sweaty or moist skin folds, or a wound that is oozing or draining. Poor nutritional intake, dehydration, swollen extremities with edema, and loss of sensation leaving a resident less sensitive to pain and pressure also place a resident at increased risk for developing pressure injuries. Weight extremes, such as being very heavy or obese, or very thin and frail, use of medical devices such as oxygen tubing, splints, or braces, and limited awareness or cognition are conditions that increase resident risk for pressure injury. And finally, multiple chronic conditions such as high blood pressure and diabetes, or a resident with a history of pressure injury make a person vulnerable to and at high risk for pressure injuries. Preventing pressure injuries is much easier than treating them after they develop. Increasing attention to prevention can save residents from unnecessary harm and death. The development of pressure injuries can be prevented in most cases using evidence-based nursing practice that includes good, prompt, and clean care. This is effective and essential to prevention. As a nursing assistant, you have one of the most important roles on the healthcare team. What you do matters. Here are some activities you can include in your daily routine to ensure you are providing good, prompt, and clean care for your residents to prevent the development of a pressure injury. First, review the care plan for the residents in your care to know what interventions have been ordered for them. Understand how to safely implement the plans, and if you have questions, ask someone who can help you. Here are examples of interventions that might be included on an individualized care plan. The care plan may inform you to check support surfaces, for example, bed and wheelchair cushions, and ensure that they are in place. If you note that anything does not look to be in safe working condition, share the information with the nurse. Offer the resident their preferred beverages and preferred food choices to support hydration and adequate nutrition intake. Help the resident to be as mobile and active as possible. Help the resident to have clean and dry skin. Remember to be gentle with fragile skin. Help the resident to moisturize their skin daily with non-irritating lotions to prevent tears. Apply skin sealants to skin and dressings to protect from resident friction and shear. Use barrier creams to prevent moisture-associated skin damage. Always use proper lifting techniques and devices when assisting the resident to move. This will also minimize shearing forces. And help the resident to maintain their heels elevated off the bed. In addition to following the resident's care plan, here are some activities to include in your daily routine that can prevent the development of pressure injury. Establish a routine, washing hands. Infection is the most common complication for a healing pressure injury. Bacteria on the surface of the skin can enter wound tissue as an injury develops, or can enter an already existing wound if exposed to bacteria. Be prepared and gather supplies as part of daily routine, and ensure the correct resident is receiving the correct care prior to the start of treatment. Lock wheelchair or bed wheels prior to providing care to ensure resident safety. When you are with a resident, observation and evaluation of their skin is important and should be done each time you give care to the resident. The nurse must be made aware of any changes in the skin. You are their first line of defense. Residents with incontinence, wounds that drain, or have moist skin from sweat should be changed more frequently. If they are damp or moist, garments and linens should be changed. Straighten wrinkled clothing, pads, blankets, and sheets. Small folds, seams, and wrinkles can cause increased pressure resulting in an injury to a resident's fragile skin. Relieve pressure by routinely turning and repositioning off a wound or a bony area. This should be done every 1 to 2 hours or as indicated on the resident's care plan. If a resident is bedfast or chairfast, they may require more frequent skin checks from every 15 minutes to an hour. Know if residents already have wounds or have a history of wounds because they will be more susceptible to developing an injury. And at the end of care, remember to document all care given and inform the nurse about any changes seen. If the cares you provide are not documented, there is no evidence of them being done. Be sure to record all of your efforts in providing safe and quality care to your residents. We've reviewed important activities to be aware of to prevent the development of pressure injuries. Now let's review actions that should be avoided. Do not place a resident directly on the pressure injury or reddened area. Avoid placing someone directly on tubing or on bedding or clothing that is lumpy, bumpy, or has wrinkles. Do not leave a resident on a bedpan or toilet for longer than necessary. Do not rub or massage bony areas or areas that are reddened or injured. Do not scrub or vigorously rub a resident's skin when bathing or drying them after bathing. And finally, do not position a resident on seams, buttons, zippers, and areas of tight clothing such as elastic bands of socks or waistbands. As the nursing assistant, it is your duty to ensure residents are turned timely according to the resident's care plan, kept clean and dry, with incontinence cleaning being performed routinely. Evaluated for skin irritation due to medical devices, such as a nasal cannula for oxygen or an indwelling Foley catheter. And examined routinely to identify any changes to the skin, so changes can be reported to nursing staff. To enhance your awareness, the Braden Scale Assessment Tool is a resource that can help you and your team in the effort to prevent pressure injuries. This is an assessment tool used by licensed nursing staff. The Braden scale is used for predicting a resident's risk for pressure injury by assessing and identifying the level of 6 specific risk factors. Just as a nursing assistant does not stage wounds as part of their practice, you are also not responsible for using the Braden scale to assess the risk a resident may have for developing a pressure injury. This is the responsibility of licensed nursing personnel. However, it is valuable to understand how the process works. The Braden scale is used to predict a resident's risk of developing a pressure injury. The licensed nursing staff assesses and scores the residents on a variety of categories from 1 to 4 on sensory perception, the ability to respond meaningfully to pressure-related discomfort. Moisture, the degree to which skin is exposed to moisture. Activity, the degree of physical activity. Mobility, the ability to change and control body position. And nutrition, usual food intake patterns. The resident is also assessed and scored from a scale of 1 to 3 on friction and shear. A risk factor score of 1 in each category is the lowest level of functioning. The total score, when categories are tallied, range from 6 which is considered most at risk, to 23, which is the lowest risk. A lower Braden score indicates a higher level of risk for pressure ulcer development. In most cases, a score of 18 or less indicates a resident with at-risk status. Although this is not the only information used to determine the level of risk a resident may have for developing a pressure injury, it is good information used to tailor interventions for an individualized care plan based on resident-specific areas of risk. This tool and others like it are to be used by licensed staff who have trained as part of the nursing scope of practice. However, knowing what your team is assessing throughout the shift can help you to determine what information to communicate and when. The following tools and devices are pressure-reducing or eliminating devices used in pressure injury prevention and include special support surfaces, air and other specially designed mattresses, bed covers and chair cushions designed to help reduce and distribute pressure evenly, heel and elbow protectors, heel and foot elevators, and foam wedges or trochanter rolls. These are repositioning devices to facilitate good body alignment. The complexity of repositioning residents to prevent pressure injuries can result in unrecognized factors that impact resident safety and can affect the quality of care you deliver. For example, healthcare trends indicate that since the early 1990s, morbid obesity and fecal incontinence have increased significantly. The following are examples of everyday factors that can unintentionally affect how residents are prioritized for repositioning and play a role in how residents receive care, including the length of time it takes to complete repositioning, the physical burden of repositioning, access to equipment and supplies to assist with repositioning, and the total complexity of care for specific residents. Certain resident safety factors affect decisions about how residents are prioritized for care. Looking for and retrieving equipment, locating and waiting on assistance from coworkers for safe repositioning, and other miscellaneous demands may impact how you prioritize your cares. These can prove to be hidden threats to patient safety and are an unfortunate reality. The nursing assistant holds an important role on the resident care team. You are often the voice for your resident and can have a positive impact on their quality of life. As you work to prevent development and worsening of pressure injuries, consider the concepts of teamwork and communication during resident care. Poor communication or falsely recording care that was not completed, such as repositioning that did not occur, can cause harm to the resident. Not reporting improper care, such as a forgotten bedpan, can also cause harm to your resident. Always report and record the completion of delegated care. Take time to ensure complete reporting of resident skin condition and other changes to nursing staff. Be honest and accurate. You make a difference. Take pride in your work as a nursing assistant and carry out the resident care delegated to you to the best of your ability. On behalf of Superior Health Quality Alliance, we thank you for your dedicated work as an integral member of the healthcare team and a valuable nursing assistant on the frontline forces. Click on the survey link that follows to answer the questions on the concepts and principles reviewed in this module. Now it's time to test your knowledge.